You're listening to Aging Uncensored.
Hi, welcome back to Aging Uncensored, where we dive into all things aging related. And I'm your host today, Chaley Lawson. It's good to see you again. And we have a co-host here today, Jason Patterson.
Yeah.
And Jason is someone I've known for a long time now.
Mm-hmm. Yeah, exactly.
And Jason is a geriatric nurse practitioner and really kind of a jack of all trades these days. He does a lot of different things. But one thing we're most excited to talk about today is foot care. So just a little warning, if you have any qualms about listening to foot care, skip ahead to the next episode. This won't be the one for you.
Yeah, there's no images, so
no images, and no one was harmed in the making of this podcast or anything like that. But so Jason, do you want to give a little? I know I just introduced you, but do you want to?
I can give some initials behind my name, how I got it. So I'm Jason Patterson. Like you said, I'm an adult geriatric nurse practitioner. We met at the geriatrics clinic, working together in primary care and doing house calls. And so one of my businesses is in-home foot care from a medical perspective. And so that it's not cosmetic. And so we do it from a medical perspective, want you to be functional. And so our target audience mostly is senior adults. And so I looked up the certification and got certified. So I'm a certified foot care specialist, CFCS, and I'm a nurse practitioner. So that's how I started the business in 2023, and it's grown. And now I have a couple of nurses, friends who work for me and help me out to grow that. So
yeah. And so I'm also a foot care nurse and got the certification and did that through getting to know you and learning more about that process. And one thing, like when we did house calls and we were doing home-based primary care and also have a background in hospice, both of us, and really just all home care and all care for older adults in facilities. Like you have a tremendous amount of experience in skilled nursing facilities and assisted living and memory care, all levels of care really. And we both recognized a need for, we were seeing patients in other roles as primary care providers and geriatric nurse practitioners. And we were seeing this huge gap in care where there's these patients who are elderly, are frail, may not be able to get to a podiatrist. There may not be...
Or a podiatrist that does home visits.
Or a podiatrist that does home visits. Or like even a lack of, in like more rural areas and facilities, like a lack of podiatry providers. And so I know for me, like when I was doing care in the geriatrics clinic, I just sort of like started clipping toenails for people when I could, just sort of figured it out. I mean, I know that sounds wild, but you just do what you have to do. And so now have had certainly more advanced training and,
better tools.
It's really nice to know when you have it's really nice to know what tools to use. So let's talk a little bit about, the way I see us is as collaborators with, or maybe not collaborators is the right word, just in the setting of advanced practice, because more of like a service alongside a podiatrist. Like we don't, a foot care nurse wouldn't replace a podiatrist, and that's not the purpose. So talk to us about that.
So I would say podiatry definitely has its defined role. So they do surgeries. They make great recommendations. They can do routine foot care.
Yep.
And I encourage people, if you can make it, my goal is to bring foot care to people who are homebound, bedbound, need caregivers.
Who wouldn't have access to it otherwise.
Right. Yep. They can't go to the office.
That's right.
And so these podiatrists aren't reaching these patients anyway.
Right.
But that doesn't mean they don't need care.
Right.
So that's where, like you said, we identified the need. And so that's where this came from. And then, we're nurses first, and then we're nurse practitioners, and we're certified in this also. So we're more we can fill in the gaps because for people who can go to the podiatrist, because podiatrists are busy.
Yeah.
I ran the numbers one time, and the population of Alabama and how many podiatrists there are, they all have 15,000 patients apiece.
Oh my gosh.
So that's a tremendous provider shortage.
Yeah, exactly. Yeah.
So foot care nurses can meet some of that need, especially for the homebound patients.
Yep.
And so we can fit in there with regular podiatry visits too. I have plenty of people who, like I said, there's a shortage, so they can't do this routine care all the time. They can't like bring someone in every 8 weeks to do toenails and callus management.
Right.
I have people who call me like, I can't see him, but every 6 months he can't.
Yeah.
He's doing surgery or whatever.
Right.
And so they see me in the gap, like in between their appointments.
Yeah, as an adjunct,
right.
And like a foot care nurse can do a lot of things. So tell me kind of what, like, I know it's going to vary and be very patient dependent on what their needs are, but what does an appointment look like? Like, what kind of services would you be bringing to these patients?
Yeah, so in general, like I said, it's from a medical perspective. And so we're going to do a thorough exam of the lower extremities, the feet, the toes, between the toes, under the feet, toenails, heels, skin, a thorough exam of all of that. And then usually we will take some pictures because, in my opinion, for documentation, nothing speaks better than the images. So we'll take pictures before, and then we'll get to work. And so we can test for neuropathy, especially with our diabetics or people with poor circulation. We can test for neuropathy with the monofilament exam. And that will let you know if you have any sensation problems. And because sensation problems in the feet can lead to poor balance, wounds that you don't even know you have. And so we try to identify that early. So a big thing of what we do is prevention. And then after that, we'll get our tools out and start trimming the nails. Usually we do the nails first, and then we'll take care of any calluses or corns with our Dremel, which is an electric nail file. And so it really can thin things out and help as easy on the skin. We don't use a blade. Podiatrists can use a blade, so that's another difference. But,
that's right.
So we do all of that, and then we do end with one nice thing that's kind of like a pampering.
The icing on the cake.
Yeah, the pampering that everyone likes is just some good hydrating lotion, cocoa butter, and a light massage to the lower extremities, feet, and toes.
Everybody loves that.
They like that part. So, and then we'll make recommendations on footwear, padding, building up your the padding to help with calluses and corns and that kind of thing. So that's a visit in a nutshell. Usually it's about 45 to 60 minutes for an initial visit, and then I would say maintenance visits are like 30 to 45.
So, I think that's right. And I think that one thing I've noticed is a lot of education. Like when I see patients to provide foot care, there's usually a lot of education that to the facility staff or the caregivers. I mean, especially for patients who are frail, they have like lots of comorbidities, they may have peripheral vascular disease or which can be poor blood flow in the lower extremities. Diabetes, wounds, fungal nails, thick nails, damaged nails, nails that are falling off, nails that are, really problematic and causing discomfort. And
a lot of this education is on footwear. I mean, the shoe. So I would say we do an exam of the legs and feet, but we also do an examination of the shoe. If there's problems, like if the patient's ambulatory. We would look at the shoes. So, and, for environment of where we practice, homes, private homes is a big part of what we do. And then facilities. I go to a lot of facilities.
And facilities, I mean, is great. That's such a huge need. I mean, like assisted living, memory care, independent. And I know that a lot of these facilities, I know it's problematic sometimes getting I don't want to say compliance because there's a lot of, there may be brain changes or things going on with the patient that makes it really difficult to provide like just routine foot care that like a nursing aide would provide. And so a lot of times it can be like education around that and how you can approach it. And I mean, I know that even patients with brain changes, cognitive impairment, like we provide care to those patients and do it effectively and in a way that's comfortable for them.
And that's kind of one of the target audiences that the certifying body that certified us focuses on. Patients with dementia and, like you said, brain changes as they age. So
yeah, because it's such a huge, it's so crucial. Like I saw a patient not long ago who had like a orthotic device, like a brace they were wearing that had been prescribed for a problem that they had. And I saw them for routine foot care, and that brace was actually had caused a pressure ulcer, and they weren't really sure what it was. And they were kind of, you know, doing some things at home, and you know, I recognized it. I still provided the routine foot care. I provided some education, and then like made a phone call to one of the podiatrists that we work with pretty closely and got him an appointment the next couple of days. Yeah. So like, I think that foot care nurses can be really good advocates too. Like if there's something that's going on and you're just not sure, like a foot care nurse is a great place to start.
Well, and like we said, a lot of this is prevention. I mean, we'll make a referral to the podiatrist, or, you know, call or get you resourced where you can do it. As the caregiver or the patient. And get you in where you need to be, get the care you need. So, and we take care of high risk patients. The big part of what we do is diabetics, people on blood thinners.
That's right.
Cancer patients. They're high risk as well. And impaired blood flow. All of those things. This is what we're trained to deal with. So,
and even hospice patients too, or patients that are bed bound. And I always, like when I'm approaching someone's foot care, I always think about what their functional status is and like, what am I trying to improve for them
really
today?
Help you determine their goals.
Right, exactly. Like my goal for someone who is on hospice and bed bound is maybe different than for someone who's walking all around. You know, like we always want to do it in a way that's, you know, promotes their dignity and their comfort and is not distressful to
their goals of care.
And their goals of care. Yeah, exactly.
Right.
Exactly.
It's really a individually tailored recommendations every visit. So what you do for an ambulatory patient who has shoes, you're going to inspect their shoes. You're not going to do that for someone who's bedbound.
That's right.
So it's just a different approach every time. So, and that's kind of one of the things that I enjoy. It's different every time. So that's right. And I think like foot care sort of gets brushed to the side. I think a lot of times these people are really sick and have had, you know, maybe extensive hospitalizations. And like, you know, if you're in the ICU on a ventilator, nobody's too worried about your toenails at that point, you know, and reasonably so. Breathing is more important.
Right, exactly.
Right.
Toenails don't end up in that algorithm, but like when we, you know, then people get home and like kind of get settled and they are on hospice and maybe have services, and like over time things just kind of build up. Their nails get really long, or maybe they're thick, and then the family's like, oh my gosh, I don't know what to do about this.
That's what we get a lot is, you know, mom or dad has been independent, they have a setback, adult child steps in to take care of them, takes the shoes off. Oh my goodness, this is the first time I've seen their mom's feet in 5 years. But she's always taking care of herself. And we need to do something.
What do I do?
And so that's a lot of the calls we get are something like that. So, and so another referral source is hospice and home health. So I'm trying to get the word out to the nurses there. So, and I would say, you know, I'm focused in the Birmingham area mostly, but there are about 8 or 10 of us statewide. And, you know, we've kind of got a map together. So I come up a lot in searches because the name is Alabama Foot Care at Home. And so I have my own map, and my receptionist trained to, if there's zip codes out of my area, then, you know, get them connected with the appropriate foot care nurse provider. So
that's good to
know. There's a little network of us.
Good. Very good.
That's a recent development.
Good. So even if you're not in the Birmingham area, reach out to Jason at Alabama Foot Care for Home, and you know, there's other resources, other foot care nurses around the state that we get connected with.
And they're wanting to grow too. They just don't have the website, or you know. I'm big on the marketing stuff and that kind of stuff. And they're just not, and that's fine.
That's okay.
So,
we got to help our friends out.
So I send them. I got people in the north and on the whole east side of the state. So.
Awesome. That's great. One thing that comes up a good bit that people ask me is people are concerned, family members and caregivers, about pain when we're providing foot care. And they'll ask me sometimes, like, are you able to numb things or do anesthesia or anything like that? So tell me, I mean, I know the answers, but tell me kind of what your experience is and like what's needed and how well it's tolerated.
So for routine foot care, if the nails are fairly healthy and not extremely long and thick, it's, I would say 99% of the time painless.
Yep.
When you have larger issues, there's a higher chance for that.
Right.
But usually that's because the nails are long. They've had pressure on that toe for so long.
That's right.
And any, slight touch of that area is going to really set them off the pain. Yeah. But I would say by and large, most of my visits are not pain. Yeah. They're painless.
Totally agree with that.
And people are surprised.
Yes, absolutely. People are. And people will say, like, I'm really sensitive about my feet. Yes. And we're, I think, like, trained to be able to manage that pretty well. And like, we have, some things that we can do to like just make it more comfortable. We don't numb or anything like that. But a lot of times, like, it's just anxiety around it. Yep. And like
talking like we're talking.
That's right. We talk to them the whole time.
And I found that don't disconnect your touch with the foot.
That's right. Yeah.
So my left hand's always on the foot.
Yep.
That's the sensitive part, is when you're having to initiate touch.
Yeah, that's exactly right. Yes.
So I hold the toe, or I hold the toes, and I don't
let go.
Don't let go. So as long as there's a tool in my other hand, I'm going to have a hold of the foot.
That's right. That's exactly right. And I do the same thing. I don't know if I realized that's why I did it, but I'm sure it is. And so, and a lot of times it's like someone I did recently had a really sensitive area we were working on. Yeah. And initially, I mean, it was the first one we looked at. Initially, they were like, oh gosh, I'm able to tolerate this. Yeah. And I was like, that's okay. Let's just move on. And then we moved on. We did the others, gained their trust, and came back to it, and it was fine.
Exactly.
So there's a lot of things.
There's people who have neuropathy. I had two in one day the other day, and their feet involuntarily jumped. Yeah. And so having a hold of the foot, I mean, just naturally helps steady it. So right. But I'm talking about pain, by and large, it's not an issue.
Right. And I know you've done some work in patients who have severe mental illness too. Is that right?
Yes.
And can you talk a little bit about that, and just kind of share, like, I want everyone to kind of understand, like, certainly this is geared towards older adults, but there's no one that's necessarily excluded from this service.
Yeah. So I partner with JBS Mental Health here in Birmingham at their day treatment program. And so the group homes come for day treatment, and while they're there, I usually go about once a month, and I'll see anywhere from 25 to 40 patients in a day. And I try to take someone with me so we can see as many as we can. But this is another underserved population.
Yep. That's right.
Severely. Yeah. And the reason is they're uninsured or underinsured. They're Medicaid only. So they're very limited on their provider network, on who they can go see, and they don't have, resources to pay outright. Right. And so the leadership there in the state agree with this need. Yeah. And so we have an agreement worked out, and so now they're all getting foot care, and I mean, there's been hospitalizations prevented from this.
Absolutely.
I mean, people and they're diabetic. They're uncontrolled diabetics. Yeah. And so they don't need to be just trying to clip their toenails at the group home by themselves.
Right. Exactly.
So it's been, I mean, I don't even know the metrics of how many hospitalizations have been avoided. But
oh my gosh, I know I don't doubt it at all. I mean, exactly. When I've seen people and they've, especially when you have, like, some of those people have been houseless or on the streets or without footwear at all. And when you have, none of this is necessarily like a cosmetic thing. Like, when you just think about, like, when you're without, like, proper routine nail and foot care, like, just all kinds of things can happen.
Proper footwear.
Yes. Yes.
Proper, clean garments of socks and that kind of thing.
Yeah.
Things we all take for granted that are just there for us.
That's right.
It's not just there for them.
That's right.
And so foot care is not a priority for them.
Right.
Because they're having to meet, more basic needs than that.
Just like it's not a priority for those patients that are on ventilators in the ICU.
Correct.
It's the same kind of thing.
Exactly. And so, yes, we get there. So our goal with that population is different than our goal with the home population.
Yeah.
Our goal there is functionality. We want them to be functional and be able, because they're all ambulatory.
That's right.
They're all ages. Yeah. They're not just senior adults. They're all ages.
Yeah.
And so our goal is to be functional.
Yep.
And so, however, through the foot care, they do just genuinely feel better.
Absolutely.
And because things look better.
Absolutely.
So.
Absolutely. It's about maintaining dignity, and even for it, whether the patient walks, all over their assisted living community, whether they're, confined to bed or chair at home or in a skilled nursing facility, whether they're in a group home at JBS and getting the care that they have, needed for so long, like no one's excluded from needing it.
Right. Exactly. So it was eye-opening, but it definitely makes me more well-rounded to deal with a lot of different things that I encounter with foot care. So
absolutely,
I'm never surprised anymore.
No, and I'm glad you said that, because I think that people can feel like a sense of shame.
Or my feet, they're too far gone.
They're too far gone.
Yeah.
Like, I absolutely promise you, like, that's just not how we approach it. We are not.
There's no judgment.
There is no judgment. We want you to get the care that you deserve. Yeah. And that's
because guess what? After that, and you go on maintenance with us, we usually recommend 2 to 3 months.
Yep.
And we can get you on a maintenance cycle. And so, and once you go into maintenance, then, you're really feeling good.
Yeah.
So, and comfortable.
That's right. Absolutely. Tell me about payment. So I know that this isn't something that insurance pays for, unfortunately. So tell me a little bit about that. If someone's getting these services, how do they pay for them?
So, so most people are familiar with Medicare, and a lot of people go to the podiatrist and Medicare pays for it. That's correct. You do have to have some type of condition that requires skilled routine foot care.
Yep. Diabetes or neuropathy or vascular disease, something.
And then even then, sometimes they don't pay.
Yeah.
And why do podiatrists not do this as often anymore? Well, they're busy, for one. There's a shortage. Second. Third, from a business standpoint, there's hardly any incentive for them to provide this, routinely. It's just not reimbursable very much.
Understandable.
So it's just not something that's easy to find in that office setting sometimes. So home visits, we come to you, we bring everything to you. It is more like a concierge type based thing. And so it is private pay, and we accept, cash, check, and card. And so and then you pay at time of service. And so we don't really invoice, but because we're everywhere. We're all over. We probably have over 100 patients, in our system. So
I mean, I would say that I know resources are always a concern for people. I would say that this is like a really good investment in someone's care.
Well, we're not coming out there every week.
Right. That's
it's
right.
Once every 3 months or something.
Right.
And, that you're getting good care.
Yeah.
And you're gonna, it's preventive care. I mean, so it's, what do they say? An ounce of prevention.
Oh yeah.
I forgot the rest. I don't know, whatever it is. Anyway, prevention goes a long way.
That's what we're trying to say here.
Yeah.
That is what we're trying to say. I forgot to mention this, but I'm glad you mentioned this about like it is a home visit or in a facility or anything like that.
Whatever the patient calls.
Wherever the patient is, wherever they are located.
Yes.
What do they need?
Oh, nothing really.
Right. Isn't that right?
So, yeah. The most that we would ask for would be if you have a recliner.
Yeah.
If you're able to be up, do you have a recliner?
Bed's okay too.
Yeah, the bed's fine. And the other thing is we may ask for a towel if we don't have the pads or whatever. Yeah. Just to help with cleanup. Yep. So other than that, that's it.
Yeah, that's it.
As long as you're comfortable, we'll get on the level of whatever we need to do.
That's right. So you really don't have to have anything. We bring everything. Mm-hmm. Yeah, Foot Care Nurse is going to bring everything to the home that is needed. It's supposed to be, there should be no stress for the caregiver. Correct. You don't need to soak your feet beforehand. That's not necessary in this type of medical foot care. Yes. I know that's a question that comes up a lot too. Mm-hmm. Why would you say not to do that?
Well, the big reason is for people with impaired sensation, diabetes, if the tissue is soft and nicks and scratches happen with this. That's just do. That's right. I would not say it's something that happens every appointment or even most appointments. Right. But anyway, if you have a nick or cut in the skin and it's softer tissue, it's harder to identify. Yeah. And then you may not know it until, after the visit and all that and that kind of thing. And so it can be more of an insidious type of infection that just kind of creeps up on you.
That's right.
So if the skin is dry, that's fine. I prefer it.
Yeah. Dry, clean skin, or, as clean as you can get it, dry. That's all we require.
Mm-hmm. Yeah. Some people still want to soak, and that's okay, but I would just recommend not. So.
Yeah. Yeah. I know you talked about going to the partnership you have with JBS and going and doing, several in a day there. Yes. Would there be possibilities to do that in other facilities too?
So I have several assisted living facilities that I contract with. The nursing homes have very good contracts with podiatrists typically. Good. Yeah. And that's just due to the nature of those facilities.
Kind of skilled nursing.
Yeah, the custodial care and that kind of thing. Yeah. So assisted living is independent living, memory care. I go to all levels of care. I have contracts with several of those. Perfect. I have them in Walker County, Fayette County, Jefferson County, and we serve also Coleman and Blount. And so South Blount and South Coleman. So yeah, if you're an administrator or your family member's there and you have a good relationship with administration, this is a good thing to mention. I'll be happy to come talk to them about how to set something up or whatever.
Perfect.
And if they're not interested in that, we can still take care of your family member.
Absolutely. Yeah. Absolutely. Yep.
So we just, whatever the resident calls home is where we go.
Perfect. So, I love that.
Yeah.
So if someone is interested in getting foot care set up for a loved one, what do they do?
So my website is alabamafootcareathome.com and the phone number is 205-739-4581. Maybe we can get it to flash up on the video with this or something. I don't know. We'll see. But yeah, alabamafootcareathome.com. Perfect. And the phone number it can be call or text. And just let Stacy, my receptionist says Stacy, let her know and she'll schedule it and give you all the information.
Awesome. So even if you're not in the Birmingham area, you can call and Stacy may be able to direct you to someone who is in your area.
Correct. Yes.
Awesome.
Mostly the north and the east of the state, all the way down to below Montgomery. I know someone.
Awesome.
The west is a little more difficult, but
awesome.
Yeah.
Good. Well, thank you.
Yeah, no problem.
Is there anything else?
No, I'm happy to help. Just reach out if you have questions.
Yeah.
So
thanks so much. I really appreciate it. Yeah. I think this is such an important topic. And I think this is a topic that people don't know what to do when they like what you said, when they start taking care of mom and they're like, oh my gosh, what do I do? And so.
Well, people don't even know this subspecialty exists.
Right. Yep.
So.
Yep.
That's the other thing. I'm just trying to get awareness out that this is a thing too. So.
Yeah. Thank you. Well, thanks so much for joining us today. Do not forget to share, subscribe, tell your mom, tell everybody. And we'll see you next time. Thank you.
Bye.